Well, we would like to welcome Dr. Voight Smith to our Tuesday morning forum here on WJJQ. We welcome Voight. Nice to have you on the radio, and it's good to see you again.
You also, Greg. Thank you so much. I love your new facility here.
Well, good. Nice to have you on. Voight, let's talk a little bit about yourself. A lot of us remember when you had your days at Spine and Sport. You worked there many years and had an opportunity to see many patients at Spine and Sport, and you've been doing a few things in between. Remember those good old days?
I do. I remember coming here, wonderful people at Spine and Sport, and have many good memories, and been doing several things. I've been on the road. I've been doing some contracting with industry. I've been working with traveling physical therapy agencies, and I just started a business in Weston.
You know, I've always been impressed by your credentials, Voight. Let's look at your background. I mean, you spent a lot of time in schooling, a lot of time continuing your education, too, and enhancing your practice.
Well, thank you, Greg. Yeah, I got a bachelor's and master's from Washington University in St. Louis, and then I got my doctorate of physical therapy degree from Creighton University in Omaha, Nebraska, and I'm an orthopedic clinical specialist, which is an accreditation that you get through the American Physical Therapy Association. And I'm also McKinsey certified. That's an international spine organization. So, you know, I love the field. I've always loved the field, and I want to provide the best care that I can and give people the best value.
I've always enjoyed your background in the military, too, at the Air Force. You learned a lot, I suspect, working there.
Very much. I worked with active duty dependents, retirees, and DOD teachers, and learned a lot about the military and got some global experience. So everywhere you go, you learn new things.
Mm-hmm. In the background that you've had, Voight, you have experienced a lot of different things. You've worked for other people. You've been in practice through clinicals, through hospitals and those types of things. But now you're on your own. How do you like it basically working for yourself?
I enjoy it. I really do. I get to be with wonderful people, and I'm in charge of my schedule, and I have flexibility to do things that I didn't have before.
And your name is Backsmith Advanced Physical Therapy. That has something to do with what we will talk about, I suspect, your back brace as well as your name, Smith. Tell us how that all came about, Voight.
My father came up with that name.
Did he? Okay.
Yes, I invented something called the Backsmith Selective Stabilization Support. It's a unique device which improves motor control and enhances posture and helps with a lot of outlier patient populations. And my father thought of the name of Backsmith because I'm Smith and we're dealing with the back, and so it kind of stuck.
It fits.
Yes.
It fits well. You know, you talk about physical therapy, all about movement, addressing motion disorders and those types of things, and it doesn't seem whatever age we are, whether we're older or whether we're younger, there are issues, Voight.
That is so true. We're designed to move. Our nervous system wants movement, space, and blood to maintain healthiness, to provide good stimulation to the brain. As we get older, we tend to get tighter. Our connective tissue gets tighter. We tend to get stiffer. And so exercise becomes an increasingly important part of our life. And ironically, people don't exercise as they should, or they exercise in ways in which they don't improve their mobility or their stability or their strength. And so a lot of them need guidance. And so that's what physical therapy helps with.
Lots of times we end up in physical therapy after an injury. What you try to do is help prevent that and get us stronger, whether it's our back or our posture and those types of things.
Yeah, unfortunately, as a society, we wait until things are completely broken before we try to fix them. And so a lot of times if we can get to things early on, get some early intervention, it can really make a big difference. We can prevent the nervous system from creating secondary hyperalgesia and creating more weakness and compensatory movement patterns and abnormal stress on other areas and more global pain. And so I'm passionate about working with people that have chronic pain issues because I do well with a lot of those outlier populations. But whenever possible, if I can help somebody with acute pain, help somebody with a minor discomfort, help somebody who's not sleeping well, I want to get early intervention whenever possible because I can provide better care that way.
Our guest on our Tuesday morning forum is Dr. Louis Voight Smith of Backsmith Advanced Physical Therapy. And you have your new office in the Weston area. That's a growing area, isn't it, Voight?
It is.
Yeah.
A lot of people, a lot of traffic. We're located at 3409 Schofield Avenue, Suite E in Weston. We're just up from Target on Schofield Avenue there, and it's definitely a booming population. It's definitely a little more intense than Tomahawk is.
Right.
But some wonderful people down there, getting to know a lot of people, a lot of movers and shakers in the Wausau region, and it's a wonderful opportunity.
Good. And you had the opportunity here, too, because you're more than happy to see clients at your physical therapy office at your home. And so it's not like we would have to travel to Weston to be able to have an appointment. And the interesting thing that I think, and we're going to talk about this more of the cash-based practice that you have, is that you will come to them if necessary.
Absolutely. I have portable equipment, and I can bring the clinic directly to your doorstep. And so some people, especially with chronic pain issues, feel more comfortable in their home setting. They're just more relaxed. They're more comfortable. They don't like a clinic setting, and they respond better. And so we want to meet the individual needs, whatever that is. Do they prefer home health? Do they need aquatic physical therapy? Do they need manual therapy? Do they need the Backsmith selective stabilization support? And so we are trying to give them the best value, trying to get them better faster, save them time and money, and improve the quality of their life.
Talking about value, talking about money, one thing we have to talk about is a cash-based practice. Explain that to folks, Voigt, how that works, and that's what you deal with.
Well, everybody wants a value. If we can get a bargain, that's a wonderful thing, and that's what we try to provide. Historically, I've worked with insurance companies. I've been a Medicare provider. That's getting increasingly more difficult. You're getting less reimbursement. You're getting higher copays. You're getting much higher premiums, and much more difficulty getting authorization. So I found that I was spending way too much time on the phone talking to insurance companies when I should be treating the patient. And so this allows me more one-on-one care. I'm able to give them much more value. I'll just give you an example. A typical hospital that I would work in Wisconsin, if I was to see a Medicaid patient, for example, I would charge $200 for the initial evaluation. Plus, if I did manual therapy, that would be another $97. If I did therapeutic exercise, that would be another $97. If I did an 8-minute ultrasound treatment, that would be $104. So you're looking at almost $500 in charges for an hour. Whereas if you come to see me, in my cash-based clinic, I provide bundled services for $100 an hour, which is a huge value, and that's what I want to provide.
You want to provide that value of $100 for the cash-based practice. I asked you about how insurance companies work, and you said you don't deal with insurance companies, but for those people who do have insurance, Voigt, you do help them, with some notes and stuff that they may try to file on their own. Is that a possibility too?
Absolutely. A person needs to check with their insurance guidelines.
Okay.
But many insurance companies will allow you, the patient, to directly submit claims to them. You get the notes from the physical therapist, and then it has the charges, even though my charges are bundled, and the invoice, and you submit that to them, and they can, pay back directly to you.
A lot of folks who do have insurance, is that something they sometimes check on, after they meet you, Voigt, and decide they'd like to have you help them out, to check on that ahead of time, and then you do your work?
I always recommend that people check with their insurance companies.
Okay.
But again, there's still a lot of people that don't have insurance or have just really high deductibles, or their insurance doesn't provide good coverage. And so in many cases, if I can get you better faster and save you time and money, it's just so much cheaper. And especially if you can avoid the need for expensive diagnostics or more invasive procedures, you're definitely money ahead.
You talk about your cash-based practice at $100 an hour, and that includes all of the different therapies and things that you would do helping get a patient well, Voigt?
Yes, if you came to me, we would sit down, talk to you, see what functional problems you're not able to do. Maybe you're not able to walk up and down stairs well. Maybe you're not able to reach into your kitchen cabinet. Maybe back pain's keeping you from sleeping at night, or you're not able to walk well, or you've had some falls. Get a better idea what are the issues that you're having trouble with functionally, and then would want to look at put you through an objective examination and determine what are the big bullies on the block that are keeping you from doing what you want to do. You know, it might be weakness, it might be poor posture, there may be other neurological conditions, and then, you know, what's a program that we can get you on to improve your strength, your mobility, your ability to function, and what can we do to help you to help yourself also. And so that we not only want to get people better, but we want to empower them to keep themselves better.
Dr. Voight Smith, our guest today on our Tuesday morning forum from Backsmith Advanced Physical Therapy, with his clinic location in Weston, and also able to help folks out here throughout the Northwoods area, because you said you're portable. You can go wherever they are.
Absolutely. I've got a room in my house where I provide physical therapy. A lot of people can come over and just have a cup of coffee with me, and then we'll do some physical therapy. A lot of people like that. I also can, I have a portable table and portable equipment. I can come directly to your home, and I can provide services there. If you're a person who has a lot of arthritis or a lot of pain and you don't do well with land-based exercises, I have access to pool, and I can do one-on-one pool therapy with you. The advantages of that is you have the buoyancy of the water, so you don't put the loading stresses on your joints. You have the viscosity of the water. It can help to reduce swelling. And because of the because of the viscosity of the water, it helps with resistance. You can provide kind of accommodating resistance. The hydrostatic pressure can help with the swelling, and in many cases that can make a huge difference. So
you talk to a lot of older people, and they always talk about physical therapy in the water, or even great exercise opportunities for older people using aquatic therapy.
Absolutely, but not only older people, younger people. There's young athletes.
Okay.
You know, if you're an individual who's had an ankle injury and you're gimping around and you've got a lot of pain, a lot of times I can get you in the water and I can do exercise with you so that you can stay conditioned and help to reduce your swelling, as well as complement what we're doing on a land-based program and get you better and faster and get you back in the game, and or to actually help you to compete better.
Your practice includes people of all ages, Voight, from young people to our seniors?
Yes, it does. It does. I don't see real young pediatric patients.
Right.
But other than that,
we were talking before about let's just say high school age kids, posture, working on the computer, texting, those types of things. You get into the frame of mind that you're slouching a little bit. You don't even realize you're doing it, but boy, it really has an effect on your health, doesn't it?
It really does. The microchip has been a double-edged sword. I mean, we've gone through this communications revolution, and I'm not sure that we fully understand the full impact of what it's done to our culture and to our bodies. But we spend a huge amount of time texting, working on computers, Game Boys, things like that. And while it's amazing what computers do, and they do add value to our lives, a lot of times that can create problems. We can start to have adaptive changes, tightening of our muscle, connective tissue. A lot of times our posture starts to change, and our body image and our sensory cortex has changed. And there's what we call maladaptive neuroplastic changes that occur, which can lead to impairments, and those impairments can lead to pain and weakness and a lot of different problems. And so a lot of times we need to be addressing the lifestyle. And unfortunately, with the changes in our healthcare, many physicians don't have time for that, or don't have the time that they really need. And so that's such an important part of care, because a lot of times that's what got the person, impaired and painful to begin with.
Sure. Are you finding, as you go through this cash-based practice that you're developing, Voight, is that hard for people to understand? Is it hard to get used to that, to come and see you and pay for your service, and boom, they're taken care of, and each time they come, rather than going through the insurance companies or waiting to hear this and that? I mean, it just seems to be a new idea.
It is a new idea, and we've been conditioned for a long time. I've been writing articles for the Senior Review, and
I've read a lot of those articles.
And there was an article on me in Business News recently, and a lot of politicians have been elected promising people that you can get free health care or affordable health care or things like that, and we don't think twice about paying $100 for our car to get repaired. or to go out to eat, or to go to a Packer game, or things like
Right.
that.
Sure.
But we've been conditioned to think that healthcare should be free, and it just isn't. You know, and if you want good quality, you know, there's a cost for that, and I think what people more and more are looking for as they're noticing that, you know, they don't have the same benefits that they had. They don't have, you know, the coverage that they used to have. They don't have the premiums are higher, that sort of thing. People want value, you know, and they're starting to look at upstream and downstream costs. You know, and with physical therapy, good quality physical therapy with an early intervention, you can the cost that you can save is staggering. You know, if you look at you know, expensive diagnostics and physician visits and you know, started out as maybe just an ankle sprain, but now you're gimping and your back hurts and your hip hurts and you're not sleeping well and you're on medication and you're having problems with that. And I mean, it just can become a vicious cycle. And if you can break that cycle, besides improving the quality of your life and helping to be more active, you can also save a lot of money.
A lot of the patients that you like to see have the opportunity to work with you, Voight, over time and get better. And you may never have to do any therapy on them again.
Absolutely. Yeah, our goal is to work ourselves out of a job and to empower people to help themselves. I feel that is the best type of healthcare. And so that is what we strive for.
Let's talk a little bit about the types of disorders that you work with, Voight. To me, it looks like you've handled situations with almost every disorder.
Yeah, pretty much from head to toe I've worked on things. You know,
Okay.
I've worked on people who have inner ear vestibular problems, who have a lot of dizziness, who have a lot of instability because of that. I've worked closely with oral surgeons and dentists with TMJ problems, jaw problems. I've seen a lot of people with back pain, spine related issues, weakness, hip pain, knee pain, ankle pain,
When you
people
say
with headaches that are
head to toe, you're
cervicogenic.
right.
Yeah, and so a lot of athletic injuries and sports injuries, a lot of posture-related things, and some of what I provide, you know, my back brace a lot of times can really help even with breathing problems that people have. A lot of times with these postural changes, it throws off the position of your diaphragm. Your diaphragm is very important in terms of breathing, but also in terms of trunk stability. And when that becomes compromised, a lot of things can go wrong.
Dr. Voight Smith, our guest from Backsmith Advanced Physical Therapy. Voight has an office in Weston. Of course, here can service his clients too in Tomahawk with his office. And the best number to call Voight would be 298-5888 if folks would like to visit with you.
Yes, 715-298-5888. And a lot of times that'll ring to my cell phone when I'm in Tomahawk, and if it rings to my office in Weston when I'm in Weston. But I'm at your service day or night, and because I'm in the type of practice I am, I can see people in a multitude of times. I see people on the weekends. I'll see people in the mornings. I'll see them in the evenings. We try to accommodate and provide the best service that we can.
A lot of shift workers here in our Northwoods area, so there is an opportunity then to, you know, work with somebody after hours, so to say, whatever their schedule is.
Yes, we try to be as customer focused as we can and to meet the needs that they have. And for some people, they're busy people. We lead busy lives, and some people it's just hard to get in, you know. And so access is another thing that I can really provide that a lot of facilities can't.
And again, Voight's number is 715-298-5888. A couple of websites, backsmithsupport.com and backsmithadvancedphysicaltherapy.com too, if they would like to check you out on the websites. Voight, you had a very nice website. I glanced at it.
Thank you very much, Greg. Backsmithsupports.com has some really neat videos. Patients have given me permission to show before-after videos of the Backsmith Selective Stabilization Support. So you can actually see it in action. You can see how the people move and how they function before and after. And there's some testimonials there which are kind of neat. So that's something that's absolutely unique to Backsmith Advanced Physical Therapy is the Backsmith Selective Stabilization Support. It's a twice patent device, and it meets unmet needs, and so.
And you, I mean, I know you're very proud of that because, you know, living up in the neighborhood, we talk quite often, and it was something you've been working on for years and years, hasn't it? Your back support.
Yes, it's evolved over time. I've gone through several different prototypes, and I've worked with the engineers at Core Products International, and I have a prototype which I think is the best, and it provides support where you need it, no more, no less. And it's an exercise device. That's kind of what's unique and different about it. It's designed to help get you moving, and which is physical therapy is all about movement, because life is all about movement.
And when you meet with patients, you can show them the brace and how that might improve their lifestyle.
Yes, for certain individuals, and the nice thing about it is for many people that get a brace, it's here's your brace, God be with you. With us, we'll actually have you try it on, see if it works for you, see if it helps you, if it improves your motor control, improves your posture, reduces your pain, helps your ability to walk, all those sort of things. Then it sells itself, and it is a value.
So you want to make sure that it's going to work for them. If it doesn't work for them, you will try some other therapy.
Absolutely.
Yeah.
Yep. We want to meet the need that they have.
Our time has gone quickly, Voigt. Nice to be visiting with Dr. Louis Voigt-Smith of Backsmith Advanced Physical Therapy. Check out the websites, backsmithsupport.com, backsmithadvancedphysicaltherapy.com, and they can call you, Dr. Smith, at 715-298-5888. This is quite the product, your back brace. That you have a couple patents on it too, and that has to be kind of a dream come true for a physician as yourself to do this.
Well, there's 2 U.S. patents on it because it is unique.
Yeah.
It's unique in the concept, and it's unique in how it works. And most back braces pretty much just immobilize you. And we're trying to give people the amount of support that they need, no more, no less. And some people just need it for a short time. Some people need it every day. But it's designed to help you to move better and to function better, and to enhance the physical exercise program that we have you on.
Folks have any questions about the cash-based practice that you have, Voigt, they certainly can call, and you guys can talk to them a little bit about it and explain how it works. We're trying to explain it today. It's really new territory that a lot of people are not familiar with.
It's new territory, but this is where healthcare is going. And it's exciting because there's so much more flexibility, and there's so many more ways that we can serve people and serve them in effective ways and save them money ultimately. So I mean, it's important for people to be thinking of upstream and downstream costs, and we can really make a difference that way.
Good. Enjoyed the time visiting with you. Nice to see you again. I see you on your bike all the time. I know how important exercise is to you because you're doing it all the time.
It's a part of my life, and it's a wonderful part of my life. And I try to set the example, and it's something that we all need.
Appreciate you coming in for the radio show. It was nice to see you again, Voigt. Nice to hear about what you're doing.
Thanks so much, and thanks to everybody in the Tomahawk community.
Good. Again, you can contact Dr. Voigt-Smith at 715-298-5888. The website's backsmithsupports.com or backsmithadvancedphysicaltherapy.com. Dr. Louis Voigt-Smith, again, the number is 715-298-5888. And his practice, of course, in Weston at 3409 Schofield Avenue. That's Suite E in Weston. And Voigt will also be happy to come to you, too. Patients that are older or are maybe not comfortable traveling, Voigt will be more than happy to come and make a house visit as such. Or you can see Voigt here at his Tomahawk location as well. Again, the number, 715-298-5888. And that's the number, 298-5888.